Thank you everyone for joining us for today's presentation, Spectrum, a partnership approach to producing impactful research. This presentation is part of HCRN Canada's Big Ideas About Health Data series, and it features a variety of experts discussing how data can be used to advance health equity. Please join me in welcoming today's speakers. Our speakers are Dr. Marni Brownell, who is the director of Spectrum, which is funded by Social Sciences, Health, and Humanities Research Council Partnership Grant. In her work, Dr. Brownell uses administrative social services and health databases to study child health and well-being and focuses in on the social and structural influences on health. Dr. Anita Dirksen is a postdoctoral research fellow at the Manitoba Centre for Health Policy, primarily working with Spectrum. Dr. Dirksen obtained her PhD from the University of Manitoba in 2024. Scott Sinclair is the Deputy Minister of Health for the province of Manitoba. Prior to assuming this role, Scott was the Deputy Minister of Consumer Protection and Government Services and Deputy Minister of Labour, Deputy Minister of Crown Services, and Deputy Minister of Infrastructure, among many other senior roles in the provincial government. Dr. Stephanie Sinclair is an Anishinaabe woman from Sandy Bay First Nation. Dr. Sinclair works at the First Nations Health and Social Secretariat of Manitoba as the lead for data sovereignty. Dr. Sinclair completed her PhD in Native Studies at the University of Manitoba. And with that, I will turn it over to our presenters.
Thank you, Dr. Nicol. Thanks for those introductions. So over the next, 40 to 45 minutes, the four of us are going to try to tell you about the Spectrum Partnership, which we have been developing and nurturing over the last several years. If we could go to the next slide, please. Manitoba is located on the treaty territories and ancestral lands of the Anishinaabe, the Ansininawak, Dakota Oyate, Dana, Ininawak, Nahotoak, and Nehewak nations, and is the national homeland of the Red River Métis. The Spectrum Partnership is dedicated to speaking the truth about the harms and wrongdoings perpetrated against Indigenous peoples in both the past and continuing today. We recognize that the very systems that we study contribute to these harms and that the data we use reflect these harms. We're also committed to speaking about the strength and resilience of Indigenous peoples and the importance of incorporating Indigenous ways of knowing into all the work that we do. We've dedicated ourselves to moving forward in meaningful partnerships with Indigenous communities in a spirit of truth, reconciliation, and partnership. And if we could go to the next slide, please. So to begin talking about Spectrum and the Spectrum Partnership, we really need to step back and start by talking about the data repository held at the Manitoba Centre for Health Policy. The research that Spectrum does isn't limited to research using the repository, and the partners in Spectrum, and there are over 100 of them, go well beyond folks at MCHP, but the idea for Spectrum really rose out of our recognition at MCHP that we had this incredible resource that we wanted to be used by researchers from multiple disciplines and to be useful not only to academic researchers, but to community groups and to government. And I'm sure he's not here, but I need to shout out Randy Francoux, who really got Spectrum rolling probably about a decade ago. So for those of you who don't know, at MCHP, we have this vast collection. It's around 100 databases that span multiple domains, and these are linkable at the individual and family level across sectors and over time. And you can see the 5 different sectors or domains on this slide. Most of the databases cover the entire population of Manitoba, and many of them go back several decades. So this makes the repository a really powerful tool for health and social services and policy research. Over the years, MCHP has built partnerships with a number of different groups to co-produce evidence using the repository. And Spectrum has really built on and expanded these partnerships, particularly expanding beyond the health sector to social services. So at this point, I'm going to turn things over to Dr. Stephanie Sinclair, who is a co-director of Spectrum, as you heard, to tell you about one of MCHP's long-standing partners, the First Nations Health and Social Secretariat of Manitoba.
Can I get the next slide? So just a little bit about our organization. It's called the First Nation Health and Social Secretariat of Manitoba. It was mandated by the Assembly of Manitoba Chiefs to serve 63 First Nations in Manitoba. We serve people at the community level as well as individually and regionally. Next slide. Through the last couple of years, we have received funding from the federal government to develop a data sovereignty team to work on creating a vision for data sovereignty in our area. So we have this vision and mission that have been developed to honor, protect our sacred responsibility to gather, analyze, interpret, and share our stories in accordance with our nationhood, past, present, and future. And the mission is to capture, protect, and share our stories in accordance with our own worldviews as self-determining nations by our people, our keepers, our storytellers, and our interpreters. Next slide, please. So we have been working on data sovereignty for over 30 years. This was just the newer stuff that we've been working on since we've had funding. But over 30 years ago, with the establishment of the first regional health survey that was developed by First Nations for First Nations to collect data on reserve, there was the development of the Health Information Research Governance Committee, which provides guidance and advice to researchers to have their research in a respectful and meaningful way with First Nations. And they also are mandated by the Chiefs and Assembly to approve and support research projects, specifically those that are linked with the Manitoba Centre for Health Policy database and our status verification system that is determines who the members are of First Nation communities. So you link those two files together and it's called the First Nation link file. So any researcher that wants to use that file has to go through our ethical review process. And I'm just going to share a little bit more about that. Can you go to the next slide? So as I mentioned, HRC started in 1998 with the development of the first survey. So they needed somewhere to store the information, somewhere to have governance over who would have access to it and how it would be used in our region. So it was developed in 1998 and it has moved and advanced through the ages and now includes social. And we have 4 guiding principles in which HRC uses to evaluate research projects and projects that we ourselves are involved in at FNISM. So I'm just going to go through those 4 principles in a bit more detail. Next slide, please. So this is just a representation of our committee. So our committee is mandated to serve the 5 language groups or cultural groups that exist in Manitoba. It also includes the Northern and Southern perspective, the Tribal Council perspective, health directors. There is an academic, First Nation academic advisor, a youth, and a knowledge keeper. So these are the team that makes up the ethical review body that looks at proposals and research for a regional within Manitoba. Next slide, please. One of the things we wanted to also point out is that HRC does not support Pan-Indigenous approaches to research. So it really does not benefit First Nations to have Pan-Indigenous research done unless you have the Métis and the Inuit as well at the table with their own governing structures working together. So we have been partners on some research projects where that has happened, but we mostly do First Nation specific research where that will have more impact on the ability to advocate as well as the ability to change policy and practice. Next slide. So the 4 criteria that have been developed for respectful research that have been endorsed by the Chiefs and Assembly and the leadership of the Manitoba First Nations include free, prior, informed consent, First Nation ethical principles, First Nations principles of OCAP, and benefit to First Nations. So I'm just going to go through them quickly as we have limited time. Next slide, please. So we'll start with free, prior, informed consent. So we are looking at both at the individual and community level. So at the community level, usually when a research project starts, we would approach the health director or the social director to introduce ourselves and be requesting that relationship, building the relationship. But we cannot proceed to collecting data or even developing a research question until you have a BCR, a Band Council resolution, which is supported by the chief and council of the community, or a letter of support that's endorsed from leadership before we would move to the next stage. And then there's also, of course, consent that is required at the individual level. It needs to be in plain language so that community members and families can understand what they are signing up for. And it needs to include information about OCAP and where the data will be stored, how it will be used, how long it will be accessible, and who will have access to it. Next slide, please. And the next slide talks about First Nation ethics. So this is just to recognize and keep in mind that each First Nation is distinct and relationships must be formed to learn about each community and to follow their distinct protocol, language, and the way they do things within their community. So there could be two Cree communities, but they do things in a different way. So this is just to recognize that when people are going into communities or forming relationships, that there is still uniqueness even with and diversity within cultural groups. Next slide is one that most people will be familiar with, which is the OCAP, talking about ownership, control, access, and possession of data. So I'm not going to go too much into that. Next slide. We do have some information on training that's available on the 4 principles. That's done through the First Nation Information Governance Center, as well as we have our own specific training that we do within our regions, some that's targeted specifically to nations and others that's targeted to academic or researchers. Next slide. And this is the last one. It's benefit to First Nation. It's really important to think about this when working with communities is what are the direct benefits that the community could see or use within your research projects. So we're talking about things like providing honorariums to partnerships, hiring local people to do the data collection and training them, working with communities to form advisory circles, and as well as recognition to own their own data, present their own data, be part of the writing and the production of knowledge about what has been collected, and then also having an impact by using the research to make changes, to advocate, and to be that partner along with them to ensure that the research is not just for publication, but also having an impact at the community level. Next slide. So I just wanted to highlight some of the products, I guess, that we have done in partnership with the MCHP, which includes, we had a data sharing agreements with the province and with MCHP to look at some of the data in terms of COVID. We've also done First Nation health reports and a child atlas report. So these are some of the graphics that are from that. We're hoping to maybe update those after, because they were both done before COVID. We've also linked the First Nation Regional Health Survey, which was the original survey that started the need for the Health Information Research Governance Committee with some of the data at MCHP. So that's something, and we've created community profiles from that data. So now I'll pass it on to Scott to talk a bit more about the province's role.
Thanks very much, Dr. Sinclair. So Manitoba has been supporting work with data in the province for several years, specifically collaborating with the Manitoba Centre for Health Policy for over 3 decades, which has enabled the establishment of Spectrum as a partnership. The province provides funding for the operation of the population research data repository and works with researchers at the center to identify impactful research opportunities to support government operations and decision-making. Manitoba also supports the repository by providing the data, facilitating the record linkages, and supporting analytical work with in-kind contributions of staff time. Our partnership with the center enables an ecosystem in Manitoba that benefits the entire government and the community that supports services across health, social service, justice, and other sectors. Manitoba is committed to using data to shape policy and operations and has a record of using data to create meaningful impact that arises out of our longstanding partnership with the center. For example, during the pandemic, Manitoba delivered a number of data-informed initiatives. We used data on historical vaccination patterns to identify socio-demographic and economic factors which were associated with lower uptake, and then developed a focused strategic rollout of vaccines to the most vulnerable populations. As Dr. Sinclair referenced, we partnered with First Nations and Finisham and AMC to identify opportunities to appropriately provide vaccinations at lower age rates due to increased higher potential outcomes from COVID. You can see on the left side of the slide as an example for our modeling, looking at various factors and their association with historical vaccination rates. This targeted vaccine rollout placed Manitoba as a leader among provinces and was successfully used to ensure the most vulnerable Manitobans receive vaccines first. Our work on this initiative was highlighted by the Auditor General in a subsequent report and will continue to support and guide how we do our work. Next slide, please. Manitoba also has used evidence generated by our academic partners to develop better policy in a range of areas. Recently, Manitoba increased the prenatal benefit, doubling it from $80 per month to $160 a month. This change is motivated by research from the Centre for Health Policy, in fact, very specifically Dr. Brownell, who did this work a number of years ago to demonstrate the benefits of increasing this marginal amount to the benefit and having significant improved outcomes in a number of social service areas. The research found that the program led to fewer lower birth weight babies and fewer preterm births. Women who received the benefit were also more likely to breastfeed their children. Next slide, please. We've also used data to develop highly accurate COVID-19 forecasts for our province. By thinking outside the box and adopting a physics-inspired approach, we developed some of the most accurate forecasts in the country. Moreover, these models were fit in a fraction of the time as our previous approach, allowing us to iterate many times faster and supporting our medical professionals in determining the policy responses to minimizing and mitigating the spread of COVID. Next slide, please. Turn it over to Anita. I think.
So yeah, perfect, thanks. So you've heard a little bit from some of our partners. I'm going to spend a bit of time describing the Spectrum Partnership now and the work that we are doing. Next slide, please. So Spectrum is a research partnership whose mission is to bring people together to use data and lived experience to inform how we can become a fairer and more just society. We share a commitment that we can achieve more by working together than we could working alone. So who is Spectrum? Spectrum partners include community organizations, government, and academics. And why did we come together? So we're looking for creative ways to improve services, programs, and policies to better serve people's needs. How are we going to do this? We're using a collaborative, participatory, applied research process and leveraging the Manitoba Population Research Data Repository, which you've heard a bit about already, to support our work. And what is the ultimate goal here is to achieve equity across the complete spectrum of outcomes, including health, education, justice, housing, income, and employment. Next slide, please. In the first few meetings, we recognized the need to establish some core values that would guide the work of Spectrum. We chose to move forward with the values of collaboration, compassion, courage, creativity and innovation, and respect for diversity. Additionally, in everything we do, we seek to apply an anti-oppression and decolonizing lens. Next slide. So this image was one of the first iterations of an attempt to describe the governance structure of Spectrum. The circles represent a non-hierarchical as well as a dynamic and sometimes cyclical aspect to the work. The outer circle, you can see that included in the partnership are numerous community organizations, government departments, and academic institutions. At the time of application, there were about 54 academic partners representing 7 different institutions and about 20 different departments across multiple disciplines. There were 38 partners from government representing about 15 departments there and 21 different community organizations. Next, no, not yet, sorry. So this is not a static partnership, and we're adding partners to it as it becomes evident that there is need for a certain perspective or if there's a voice missing at the table. And the inner circles represent aspects of the work, so including any ongoing research projects, several working groups, and aspects of functioning such as workshop planning, evaluation, and student engagement. Next slide. So I mentioned that Spectrum applies an anti-oppression and decolonizing lens to the work. We established a working group to focus on this. In meetings, we were advised by one of our partners that talking about this work with negative words like anti-oppression is not ideal, and that a positive name can provide more clarity for the working group and for the partnership. So we have gone through several iterations of names, eventually landing on SEEK, which represents Space for Emerging and Re-emerging Knowledges. This working group has grappled with questions of space and structure, has developed and implemented some guiding frameworks for how the partnership operates, and is responsible for continuously working to make Spectrum a safer space for all partners, creating space for many voices and ways of knowing, and making resources available to all partners to support this work. The word seek itself represents a posture of openness, listening, and actively looking for perspectives to include in the work Spectrum does. Next slide. So during the first few years of Spectrum's existence, which were supported by a SSHRC Partnership Development Grant, we conducted a demonstration project to show how the partnership could work together to identify a key area in which change was needed to improve lives of Manitobans, to generate a timely and relevant research question by listening and learning from each other, as well to do the research in a collaborative way using the Manitoba Population Research Data Repository, and also ultimately to translate those findings for community and government actions, changing policy if the evidence supports it. Next slide, please. The demonstration project looked at the impact of a child being taken into out-of-home care and was recently published in the Lancet. Next slide. So over the course of several workshops, we identified child welfare as a key area in which improvement and therefore research was necessary. Next slide, please. Partners expressed concern over the disproportionate representation of First Nations children in the child welfare system. In Manitoba, while only 15% of all children are First Nations, 80% of children in the child welfare system are First Nations. Next slide. We spent time listening to our partners and worked together to develop a research question to address this issue. Next slide. So we established an advisory circle for this project, members of which were appointed by the First Nations Family Advocates Office, an office established by the Assembly of Manitoba Chiefs in 2015 and is the only one of its kind in Canada. The advisory circle included knowledge keepers, grandmothers, and representatives of the First Nations Family Advocate Office. The advisory circle was present at each step of the research project, including the development of the research question, the study design, interpretation of the findings, and knowledge translation. Next slide. So also included in the partnership are researchers with intimate working knowledge of the Manitoba Population Data Research Data Repository. So using their experience, a data analysis plan was developed to answer the question, what are the health and social impacts of being taken into out-of-home care? Next slide. So this slide represents all the children who come into contact with the child welfare system. There's a wide range of children, including those who are deemed safe in their homes and those who are very clearly unsafe in their homes. We were interested in studying those children for whom the decision to place them into out-of-home care was discretionary. So in other words, in one case, the agency might choose to remove the child from the home, and in another case, an agency would keep a similar child with a similar situation and characteristics in the family home. Next slide. Using the data repository at MCHP, 2 groups of children were then compared, those who were taken into out-of-home care and those who stayed with their families and received supports. We adjusted for potential confounders, which included variables related to the child, such as sex, age, mental and physical health, and also variables related to the mother or to the household, such as family size, age at birth, maternal mental health, socioeconomic status, and prior involvement with the justice system, among others. We were interested in health, education, and justice outcomes for these 2 groups. Next slide, thank you. Among children who remained with their families, there were fewer teen pregnancies, fewer teen births, fewer positive STI tests, fewer youth charged with a crime, and fewer youth incarcerated when compared to children who were removed from their families and placed into out-of-home care. There were also a few positive outcomes associated with being taken into care, including increased rates of immunization and reduced odds of being a witness to a crime. Next slide. So the results of the project were presented to the advisory circle, and they worked together with the demonstration project team to develop communications that were easy to understand, impactful, and clear. Next slide. This project reinforced for us that this kind of multidisciplinary partnership can accomplish important research that would not be possible without this collaborative, non-hierarchical, and inclusive approach. By working through the demonstration project from start to finish, we have increased our capacity, having collaborated and learned from each other, and now have a better understanding of what each partner can bring to the process. Next slide, and I think that is back to Scott.
Thanks, Anita. So I want to speak a little bit about how we turn evidence into policy. So governments across Canada, including Manitoba, and from my perspective in particular Manitoba, are hungry for insights and want to learn from the latest research and analysis that's available. However, there's still a lot of work to be done in establishing a culture of data-informed policy and turning those insights into actions. I want to speak about 2 ways in which research can be designed, presented, and delivered to maximize the chances of being influential. Next slide, please. First, I would encourage you to ask yourself what the window of opportunity in the policy area looks like. Is the window of opportunity to influence decision-making open? Will it open? How is it open? If your target audience is not willing to hear you, you may not be able to influence decision-making. If they're not willing to hear some ideas, then you need to change your focus. If the evidence challenges the norms of the policy environment, you may not get very far. You should also ask yourself, is the window of opportunity going to stay open? For how long? Can you help keep it open? If you deliver your research only after a decision has been made, the chance of a government revisiting their direction is very low. Next slide, please. Second, you should remind yourself often that government is different from academia. When you deliver your findings, your work needs to be accessible to policymakers, many of whom don't have the technical background, the academic background. Many leaders come from management, policy, social services, healthcare. Many don't understand jargon or lack the intuition on concepts like confidence intervals. They don't have time to read detailed technical papers or brush up on their statistical methods. You need to find a way to make your work meaningful to them without oversimplifying it while still describing its rigor and its accuracy. For example, within the Spectrum project, Anita made reference to things called odds ratios. We had to work diligently on how to communicate concepts like these in a way that would make sense to decision makers and practitioners. social workers making those determinations, those discretionary determinations on the front lines as to what are the odds of a teen pregnancy versus our caseload may have 900 fewer incarcerations if there's a change in decision. Next slide, please. So the commitment for government to learn from evidence is strong, but not open-ended. Government is an organization like other organizations and has a self-preservation focus to it. There are lots of existing structures, existing norms, existing beliefs that can be challenged by evidence. Governments need to collectively stand up and determine how evidence can be used to make significant policy change. So long as we work with our partners in a good place and in a good way, with the outcomes of improving the performance of programs and the outcomes of policies, stand a better chance of ensuring that evidence will inform and can inform and influence government policy.
And just to speak about some of the benefits to First Nations from this type of work, using this type of work is important to reflect some of the things that communities have been saying, which is that children belong with their families, are as close to community as they can be. So using the research results to improve individual, family, and community health outcomes, acting on results, putting it into action, putting it into practice. How can we support communities to keep children within their community or within the family? Developing programs and services to meet the needs of the community, and again, advocating for change to policy and practice in the area of child and family services. Next slide.
So in terms of where we are now and where does Spectrum go from here, as was mentioned in the introduction, we've recently received a SSHRC, or a Social Sciences and Humanities Research Council Partnership Grant. That gives us 7 years of funding, and a much more substantial funding than we had for the Partnership Development Grant. And so leading up to doing the partnership development or the partnership grant proposal, we held a number of whole partnership workshops where we talked about the future of Spectrum and what we thought would be important to do research on. And through a number of facilitated discussions and ranking of choices, 4 research themes really rose to the top, and you can see them here. There was the importance of continuing research on child and family services, so continuing the demonstration project research, housing and homelessness, basic income, and mental health and addictions. And you will recognize that these are intersecting, they're really not separate topics. And Indigenous data sovereignty applies to all of them, as does the exploration of and documentation of databases and data biases and data gaps. So for each of these 4 research themes, we'll have research teams that include our 3 types of partners. So we always have in our research teams someone representing government, someone representing community, and someone representing academia. An important component is we're continually checking with our partners. Are we asking the right questions? What is going to be of value to you? Is the evidence we're producing going to be actionable, as Scott mentioned? Can we identify feasible policy options that we could present to decision makers? And how do we communicate the evidence that we co-produce to a variety of different audiences? We're also repeatedly asking, is there anyone who should be at the table who isn't? So we're always asking, are there voices that need to be heard in the work we're doing to make this work meaningful? And so the research teams for each of these themes may change as new research questions are explored and as we recognize we need different expertise around the table. Along with research team meetings throughout the 7 years of the partnership grant, we'll continue to engage with the whole partnership to not only share our progress on each of these research themes, but to set new research priorities. We know that new things come up that folks are interested in looking at, and we think it's really important to hear about that regularly. And so we'll do that through continuing our full partnership workshops. We also recognize that not all our partners are always able to attend these gatherings or to participate on the research teams, because those meetings, we have those meetings every 2 to 3 weeks. It's a huge time commitment. And particularly for our community partners, who are stretched to the limit, they may not have the time to be coming to meetings every couple of weeks. So we're building in processes to meet our community partners in their spaces at times that work best for them. And once again, that's all to ensure that all our partners' voices are being heard. And so if we can go to the next slide, I thought it would be nice to end with some pictures from some of our workshops, just to underscore the importance of building trust and relationships when co-producing research that we hope will have an impact on improving services, programs, policy, and ultimately, as Anita said when she was going through our mission, to improve and I guess attain equity across all outcomes. And the next slide, I think, is our QR code for our website, which I encourage you to attend. And I see we made it in 40 minutes, which, I'm really impressed with our team.